request permission to read from a printed document on occasion.
Without objection, it is so ordered.
Great. First of all, I'd like to thank my colleagues, the author of the bill and the co-sponsors of the bill, for bringing the bill forward. It's important that we have this conversation. So thank you. Also, I was thinking about this in the context of the speech we heard just the other night from our governor, and I was thinking about it like trying to put together an analogy of what this would be like. And Mr. Speaker, the only analogy I could come up with is like you go into the emergency room and the attending physician pulls out a gun and shoots you and then says, "Here, let me help you with your injury." That's kind of what we've experienced in the state of Wisconsin. And I think it's worthy of us having a conversation about what we went through so that we don't go through it again. And this is just the start of the conversation, I imagine. So one of the documents that I want to refer to is a recently published piece from the Brownstone Institute from July of 2021. And they said the question is whether and to what extent lockdowns worked to control the virus. And their conclusion is the answer is no. For a variety of reasons, they list bad data, no correlations, no causal demonstration, anomalous exceptions, and so on. They said there's no relationship between lockdowns and virus control. And then they go on and they cite 40 independent scientific studies, 40 independent scientific studies from around the world. There's some from Italy and France and Belgium and Jerusalem and all over. I mean, some of the names of the authors here I can't even pronounce. And they go all the way through 2020 and into 2021. I mean, these are over and over again, these scientific, data-driven studies that they have combed through, and over again, they said the resounding demonstration of these studies have come to the same conclusion. I'll just read a couple of excerpts, if you will. One was from October 2020, written by Adam McCann, and they conclude this study assesses and ranks the stringencies in the United States by states. The results are plotted against deaths per capita and unemployment, and the graphics reveal no relationship in stringency level as it relates to death rates, but it finds a clear relationship between stringency and unemployment. Another one from August of 2020 from New Zealand, they said lockdowns do not reduce COVID-19 deaths. And then there's there's dozens of these. Here's one from March of 2021. This was by authors Savaris, Pumi, Dalzocchio, and Kunst. They said a recent mathematical model has suggested that staying at home did not play a dominant role in reducing COVID-19 transmission. They go on, they say, after pre-processing the data, 87 regions around the world were included, yielding 3,741 pairwise comparisons for linear regression analysis. Only 63, 1.6% comparisons were significant. With our results, we were not able to explain if COVID-19 mortality is reduced by staying at home in 98% of the comparisons after epidemiological. Somebody could probably help me with that. That's a tough one to say. There you go. Yeah, well, but you got to put the logical on the back part of that. So there you go. Thank you. We were not able to explain the variation of deaths per million in different regions in the world by social isolation, herein analyzed as differences in staying at home compared to baseline. They were unable to explain any difference. If the restrictive and global comparisons, in the restrictive and global comparisons, only 3% and 1.6% of the comparisons were significantly different respectively. And then another one cites psychological research. This was, I think this was done, I don't know where that was done. It was February 2021. They said psychological research supports the proposition that lengthy lockdowns, I find this fascinating. This is really interesting. That the psychological research supports the proposition that lengthy lockdowns may exacerbate stressors such as social isolation. Boy, I need some water. And unemployment that have been shown to be strong predictors of falling ill if exposed to a respiratory virus. In other words, by being unemployed or being socially isolated, we become more vulnerable to a respiratory illness. Well, that means that we might have just made matters worse, Mr. Speaker. The conclusion in their piece, they say that lockdowns have had little to no public health effects. They have imposed enormous economic and social costs where they have been adopted. In consequence, lockdown policies are ill-founded and should be rejected as a pandemic policy instrument. Most recently, in January of 2022, Johns Hopkins Institute for Applied Economics, Global Health, and the Study of Business Enterprise released a report called A Literature Review and Meta-Analysis of the Effects of Lockdowns on COVID-19 Mortality. It's a long, long study, and the good news is I'm not going to quote a whole bunch of it. But the abstract says, this study employed a systemic search and screening procedure in which over 18,000 studies were identified that could potentially address the belief posed. After 3 levels of screening, 34 studies ultimately qualified. Of those 34 eligible studies, 24 qualified for inclusion in the meta-analysis. They were separated into 3 groups: lockdown stringency, shelter in place, and specific NPI studies. That's non-pharmaceutical interventions. An analysis of each of these 3 groups support the conclusion that lockdowns have had little to no effect on COVID-19 mortality. More specifically, stringency index studies finds that lockdowns in Europe and the United States only reduce COVID mortality by 0.2% on average. That's a reduction in the mortality, which we know is a small percentage anyway. The stay-at-home or the shelter-in-place orders were also ineffective, only reducing COVID-19 mortality by 2.9% on average. And the specific non-pharmaceutical interventions also find no broad-based evidence of noticeable effects on COVID-19 mortality. While this meta-analysis concludes that lockdowns have had little to no public health effects, they have imposed enormous economic and social costs where they have been adopted. In consequence, lockdown policies are ill-founded and should be rejected as pandemic policy instruments. So while today's bill is a step in the right direction, it is a very small step. We need a comprehensive review and editing of our Chapter 252 Emergency Powers Authority. We should learn the lessons of this pandemic and make sure we don't repeat it in the future. Thank you for your time, Mr. Speaker.
The question is, Assembly Bill 912, having been read 3 times, shall